Hi everybody, Dr. Nick here from Windrose Health Center. Just wanted to share a quick exercise tip for anyone suffering from any pain, especially pain in the inside of their knees. Now, knee pain is something that we often tell our patients is boring, not because we don't like treating knees, but because knee pain is often either traumatic, meaning that there's a specific athletic event that has led to knee pain taking place, or it's mechanical, meaning that it's coming from somewhere else in the kinetic chain, not functioning optimally. One of the larger contributing factors to that is glute stability or pelvic stability. So here's an exercise that will greatly affect those muscles to help strengthen the knee and keep that pain at bay. So here I have a medium strength mini band, okay? This one's taken a few beatings, but we're gonna take this, I'm gonna throw it into position A, which is right above my patella or my kneecap, okay? All right, now I always tell my patients that I want them to assume a defensive position, and no sport in the world do people play defense like this. It's like this, right? Our knees are pushed out, my glutes are engaged, the band is a guitar string the entire time, all right? Now we'll give them two primary movements to do. The first one is affectionately called the granny walk, not because I dislike my granny, but because I always think of her how she walks with her walker out in front of her, right? The glutes are down, engaged, and I'm gonna walk forwards. Short, choppy steps, okay? Butt down the whole time, playing defense, waiting for that defensive position to take place, moving backwards. Okay, that's one. The second exercise is the similar position, butt down, playing defense, waiting for that person to come try to tackle me. I'm ready for it. Everything is engaged. I'm strong here, and I'm going to go side to side. Okay, my trailing knee is never dragged. It's always pushed out against the tension of the band. Glutes are tight the entire time. Similarly, I can put the band in what I call position B, which is right over the laces of the shoes. Okay, same idea. Defensive position, okay, your legs are engaged, I'm nice and strong here, and I'm going to go side to side. Or forwards and backwards. Keeping these strong. Another great exercise to make sure that the hips are engaged, or any sort of modifications to things that you'll see people doing often in any sort of commercial gym setting. One of the exercises is this whole fire hydrant thing. Now this is great if this is what you need to do to feel that muscle contract, but we can do better, okay? One of my favorite modifications to this is essentially what we would call a modified hip car or controlled articular rotation, okay? I'm gonna get in that tabletop position, making sure that I'm staying in that neutral spine position. I'm strong here in my hands, and I'm gonna squeeze this leg up towards my chest. Then I'm going to push it out to the wall as high as I can. Squeeze my butt back, turn it in, squeeze my butt up, and down. The second half of the rep is to do the opposite. So I'm going to squeeze my hip into extension, really squeezing my glute. Externally rotate the leg, bring it up into abduction, squeeze, 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 back into flexion, and then down. So that hip car exercise was done in real time. If I was to prescribe that to any of my patients, I would tell them that I want each of those half moon or half square rotations to take at least 10 seconds. You will get a squeeze in your glute like you will never believe, and I want you to fight through that a little bit to get through that range and really build some of that stability. Now, common compensations that we often see are when people go to do the car, they're doing one of these things. Okay, so again, the movement has to take place at the hip. Most of our effort is going to be keeping our shoulders and hips parallel to the floor, squeezing up, abduct, out, internally rotate, squeeze, down, and then the opposite, extension, externally rotate, abduct, flex, down. I hope you guys enjoyed these exercise tips for any sort of medial knee pain or lateral pelvic pain. Now, regarding these exercises, just a reminder that these are not necessarily for everyone, and if these painful movements persist, make sure you talk to your necessary health provider to make sure you get assessed properly and make sure that these exercises are right for you. Take care.
As always, guys, thank you so much for watching. If you like this video, please give it a thumbs up and click subscribe. We will be coming back to posting once a week, so we will see you guys next time.